All right, good afternoon. Welcome to the November meeting of the SGB. I feel like we were just here a second ago. I would like to welcome all the panel members and the audience to the November meeting of the Scientific Guidance Panel for Biomonitoring California, more formally known as the California Environmental Contaminant Biomonitoring Program. Thank you all for joining us today. So as I mentioned, the panel last met this morning from 9 o'clock to noon for the rescheduled August SGP meeting. The main items, we heard some updates from CDPH, program updates. We also heard a talk from DTSC on some updates to methodologies to detect PFAS compounds. And then we ended on an item that discussed an expansion of the designated group for PFAS, and that passed unanimously. So it's quite an active morning. And just so everyone knows, a summary and transcript will be posted for this morning's meeting, as well as this afternoon's meeting, to the biomonitoring webpage. All right, so I will now invite the panel members to introduce themselves by name and affiliation. So let's start with Carl.
I'm Carl Craner, Department of Philosophy and also in Environmental Toxicology at UC Riverside. I have COVID today, so I can't be present.
Thanks, Carl. Laura.
Good afternoon, Laura Cushing, Assistant Professor of Environmental Health Sciences from UCLA.
Tom.
Hello, I'm Tom McCone, Professor Emeritus at the School of Public Health, the University of California, Berkeley, and also a retired affiliate at Lawrence Berkeley National Laboratory.
Hello, Ulrika Luderer, Professor of Environmental and Occupational Health in the Program in Public Health at UC Irvine.
Jenny.
Hi, everybody. I'm Penelope or Jenny Quintana. I'm a Professor of Environmental Health at the School of Public Health at San Jose University.
I'm Meg Schwarzman, faculty at UC Berkeley School of Public Health, Environmental Health Sciences Division.
Oliver Fien, Professor at the College of Biological Sciences and the Genome Center at University of California, Davis.
Jose Suarez, Associate Professor at the Herbert Wertheim School of Public Health at UC San Diego.
All right, great. Thanks for all the introductions. So now I'll hand this off to the panel chair, Meg Schwarzman.
Our opening reminder for panel members to please comply with Bagley-Keene requirements that all discussions and deliberations of the panel need to be conducted during the meeting, not on breaks or with individual members of the panel on or offline, including via phone, email, chats, or text messages. So the plan for this afternoon's meeting will open with an update from the program on the AB 617 Community Biomonitoring Studies, followed by presentations on the results from the Stockton Air Pollution Exposure Project, SAPEP. There will be time for questions from the panel and the audience after each presentation. Instructions for how to engage. If SGP members wish to speak or ask a question, please raise your hand. I'll call on you. If online webinar attendees have questions or comments during the question periods after each talk, you can submit them via the Q&A feature of Zoom webinar or by email to biomonitoring@oehha.ca.gov. Just to note that we will not be using the chat function of Zoom during this meeting. Please keep your comments brief and focused on the items under discussion. Relevant comments will be read aloud and paraphrased as necessary. If online attendees wish to speak during public comment periods and discussion sessions, please use the raised hand feature in Zoom webinar, and Rebecca Beloso will call you at the appropriate time. If you're attending in person and wish to comment during the public comment periods and discussion sessions, please come to the front or raise your hand and I'll call on you. And reminder to please identify yourself before providing comment and write your name and affiliation on the sign-in sheet at the back of the room. So I will now introduce again Stephanie Jarmul. Stephanie is the section chief of the Safer Alternatives Assessment and Biomonitoring section at the Office of Environmental Health Hazard Assessment. She'll provide an update on the program's community biomonitoring studies to support AB 617 and the Community Air Protection Program.
Thank you, Meg, and hello, everyone. Today, I'm going to be talking about the community biomonitoring studies we have going on at the moment, which support the goals of AB 617 and the Community Air Protection Program. So I'll first give an update on our current studies, which are Biosphere, Fresca Mujeres, and SAPEP, and I'll also talk briefly about our plans for future activities. So Biosphere is the biomonitoring component of the San Joaquin Valley Pollution and Health Environmental Research Study, or formerly known as the Total Exposure Study, or SPHERE. As a reminder of general study components, SPHERE is a CARB-funded study designed to assess exposures to air pollutants and noise among families living in Fresno and Stockton. They recruited child-parent pairs from each household and are conducting household and personal air monitoring, measuring noise levels, and collecting exposure survey data. And then for Biosphere, we added on the biomonitoring component, which consists of collecting urine samples from the SPHERE participants and analyzing them for metabolites of PAHs and VOCs, biomarkers of oxidative stress, inflammation, and lung injury, and also cotinine to identify potential exposures to tobacco smoke. And a reminder, these are the same biomarkers used for our SAPEP study in Stockton. And we also added on to SPHERE's air sampling to be able to measure PAHs. So an update on Biosphere, the team has completed a majority of the field work in both Fresno and Stockton, and that includes collection of urine samples, administration of questionnaires, collection of air samples inside and outside of participants' homes, and also personal air sampling of PM 2.5. Our original goal was to have 90 parent-child pairs, 45 in both Fresno and Stockton, but we did have some unforeseen staffing changes in Stockton, so we're only able to collect samples from 12 families in Stockton. However, we are on target to actually surpass our goal in the Fresno area by a few participants. And so our new study target is 176 total urine samples from 64 parent-child pairs, or 128 participants. And that includes repeat sampling for 4 consecutive days for 8 of the families. And we just have a couple of participants left to complete all study components, and that is scheduled to be finished by the end of November. And then I can just show the top photo here. I think there's a delay in my marker. Is of UCB and UC Merced project staff, including graduate students and staff from the Central California Asthma Collaborative, or CCAC, who is our community partner in Fresno. And the bottom photo here shows a SPHERE sampling cart, which was deployed with a Sensit ramp for collecting real-time PM 2.5 and criteria air pollutants, an aerosol black carbon detector, or ABCD, a PAH air sampling pump and impactor, and a noise monitor. This cart was deployed both indoors and outdoors of each participant's home. And as shown on the top here, this is a passive PM sampler inside of a weather shield, and we deployed these at a subset of homes. So that is it for Biosphere. Moving on to our Fresca Mujeres study, or the farm worker women and respiratory exposure to smoke from swamp cooler air study. These are all a mouthful. Fresca Mujeres is a study where we were again able to add on a biomonitoring component to the existing Fresca study, and that was funded by the EPA. The goals of the original Fresca project were to reduce wildfire smoke exposures by designing, testing, and deploying an affordable and effective filtration system for residential evaporative or swamp coolers. And you may recall hearing about this study more at the November 22 meeting, where Gina Solomon of PHI and Naomi Martinez of CCEJN presented on this. And a reminder, this first part of the study took place in 2022 and completed then. So Fresco Mujeres builds upon the original Fresco study by focusing on farm worker women living in the Fresno, Kern, and Kings counties. Based on the field testing of the swamp cooler filters completed during Fresca, we deployed the swamp cooler filters, which were found to have the highest particle removal capacity in half of the homes. And then we also deployed portable air cleaners at all of participants' homes. We also collected urine samples to look at exposures to air pollutants, and that includes metabolites of PAHs, VOCs, and heavy metals, and then also of oxidative stress and inflammation, both before and during the wildfire season. For Fresca Mujeres, our lab at EHL will be completing the analyses for the PAHs and heavy metals. And then Peyton Jacobs' lab at UCSF will be completing the analyses for the VOCs. And the Wadsworth Center in New York will be analyzing the biomarkers of effect, which total about 19 biomarkers this time around compared to the 4 that we measured in SafeHep and Biosphere. And the biomarkers of effect for this study is funded by the larger Fresca Mujeres study by the California Breast Cancer Research Program. And then we also measured PAHs, VOCs, heavy metals, and particulate matter, both inside and outside of participants' homes, and also administered surveys to the participants. Just to go into a bit more detail about all the study activities over the past 6 months or so, we finished recruitment over the summer and spring months of this year and collected first morning voids from participants to hopefully establish a baseline exposure. We conducted pilot testing of the air monitoring equipment to make sure we limited the risk of oversaturation of our air sampling tubes. We installed purple air monitors inside and outside of participants' homes and administered household and exposure surveys. We also took the opportunity to have some of the participants wear wristbands in the spring and summer months when pesticides were more likely to be applied. And we're hoping to be able to test, analyze these wristbands through a lab at USGS to identify which pesticides were more likely to be applied, and hope to analyze these wristbands also for other contaminants as well. The study also performed maintenance on the swamp coolers at this time to ensure they would be functioning properly in case of a wildfire event. And over here is just a quick breakdown of our study participants. They were 100% Hispanic, Latina, and female. Most of them are farm workers or work in some sort of food packing facility. A majority of them rated their air quality as poor and reported health impacts from the heat in the last year. They were also dissatisfied with the current function of their swamp coolers. And this is information we collected before the filters were installed in the homes. And just again highlights the impacts of air pollution on these communities and the need for these types of studies in the San Joaquin Valley. So once participants were recruited and we collected their first set of urine, we deployed the swamp cooler filters and portable air cleaners at participants' homes. This time around, we wanted to collect both evening and first morning void samples to assess levels of biomarkers of the PAHs, VOCs, and heavy metals before and after the intervention, and that was exposure to filtered air. We also administered exposure surveys and monitored indoor and outdoor air for PAHs, VOCs, heavy metals, and particulate matter. You can see in the photos here, the top one depicts one of our swamp cooler interventions where we installed these filters on all 3 sides of the swamp cooler, so it was completely enclosed by these filters. And then the photo at the bottom here shows one of the indoor air cleaners at a participant's home and also the air sampling equipment. Fresco Mujeres also collected saliva to look at telomere length, and those will be analyzed by UCSF, again funded by the California Breast Cancer Research Program. Unfortunately, or fortunately for Central Valley residents, there was not a major smoke event that occurred near the vicinity of our participants' homes. I'm sure many of you are aware that we had unprecedented amounts of rain and even a hurricane that swept through Southern California and parts of the Central Valley this year. So it will not allow us to say much about the components of wildfire smoke, and how these filters might reduce exposures during a wildfire event. But we believe the study will still prove valuable to identify exposures to these communities at 2 different time points, and hopefully identify a low-cost solution to help improve air in homes that use swamp cooler filters even more generally. Some of these filters are really filthy when we pick them up. I'll just note, and so hopefully that prevented some of those larger particles from entering the home. And we did end up saving 1 filter per home, and we're sent it to Jeff Wagner's lab at CDPH, and he'll be doing some particle analyses to hopefully try to figure out the types of particles that are being absorbed by the filters. And I will also mention that although we don't have our results yet, the participants also generally seemed very happy with the swamp cooler filters, as they noticed less dust entering their homes. And we did also provide indoor portable air filters for the homes to keep, and even provided new filters for these at the end of the study. And here's just some photos from the field. We had a great team out there in both the Bakersfield and Coalinga areas. You can see the photo on the left here is of the team in Coalinga, which includes staff from OEHHA, Public Health Institute, and our community partners from CCEJN, without whom the study would not have been possible. They were really front and center with recruitment, scheduling appointments with participants, and even administered some of the surveys and collected biospecimens from some of the participants. And then in the middle, we have one of OEHHA's scientists switching out the filter of the air purifiers at the end of the study. And then on the right is with an additional CCEJN staff member in the Bakersfield area, OEHHA and CDPH staff, and then one of our partners from the Illinois Institute of Technology, who actually designed the swamp cooler filter intervention. And again, you can see right here another example of a swamp cooler with a filter attached to it.
So, hi Michael, how you doing?
One second. Okay. Well, that was it for our Fresca Mujeres update. But last but not least, our Stockton Air Pollution Exposure Project, which you've heard quite a bit about from previous meetings, and we'll be delving into the data analyses in the later presentations. But I just wanted to provide a quick reminder of the study elements and an update on some of the broader activities we've been working on. So as a reminder, this is a study which took place at a school in Stockton in late 2021, and the goals of the study were to learn more about air pollution exposures to school children in Stockton and to evaluate the effectiveness of school air filtration at reducing children's air pollution exposures. We completed results return for the biomarkers of response in October, and that included the development of a new fact sheet. So that completed our results return for this study. We also completed initial data analyses for both the biomonitoring and air sampling data, which you'll be hearing more about in detail later this afternoon. And we are currently in discussions with the principal at the study school to plan a meeting to discuss results with the participants and the larger community sometime later this year or early winter of next year. Okay, and then to discuss some of our short-term and long-term planned activities for these community studies focusing on air pollution exposures. Well, first up, we'll be working through all the laboratory and data analyses for Fresca and Biosphere. As part of that, we also plan to support the analyses of the wristbands that we collected during Fresca. Of course, results returned from Fresca and Biosphere. And I believe you've said this before, but we really want to take some time in the coming year to learn from our current studies, Fresca, Biosphere, and SAPEP, about the utility of our current suite of biomarkers we're using to assess exposures to air pollution and how we might design even smarter and more efficient studies moving forward. We've also talked about potentially conducting additional listening sessions or receiving additional feedback on our results return materials, since it has been a while since we've solicited input from outside partners. We are also exploring the possibility of a pilot study on oil and gas exposures in California. And then we hope to continue to work to identify novel biomarkers for air pollution exposures and support the labs to validate laboratory methods for biomarkers of air pollution exposures. Our more long-term plans are still to develop an RFI to identify opportunities for future community biomonitoring studies. We are now hoping to be able to issue the RFI in 2024 to develop studies that would be supported by contract funds from fiscal year 2025, 2026, and beyond. And that concludes my presentation. Any questions?
We have 5 minutes now for questions for Stephanie. Clarifying questions, Tom.
Very interesting, thank you. Just some technical clarification. So the filters that you strapped on to the swamp coolers, do you know what MERV rating those were? And,
I think they were 13. They tested a number of them. I initially had actually a slide on that I removed. I should have kept it. But yeah, they tested out a number of different MERVs, and I think it was MERV 13 that they wanted to balance out the particle removal, but also prevent obstruction of airflow into the homes as well.
Yeah, that's what I mean. What I was getting to is, did you measure any degradation in performance?
We did.
Okay.
We don't have those results yet, but it didn't seem like it impacted too much. Although for some of the filters, they were really filthy and completely covered in dust. And I will mention that these are not meant to be long-term solutions, and even the team at IIT wanted to make sure that we remove the filters after a couple of months. Really, this was for the participants to help put on their swamp coolers during a wildfire event to prevent smoke from coming in.
And just another technical on the purple air filters. So you have to get that information online. Did you, I mean, do you have a protocol for recording the data, and which of the, there's several metrics that Purple Air puts up, like raw particle count, EPA standard. Did you come up with a decision about which metric of air quality you would use, and then how you would store that? Because I mean, Purple Air keeps it online. You don't get to.
Right. I don't know if we've had the discussion. Maybe McKenna, who is quickly becoming our Purple Air expert, might have further insights.
Yeah, not too much. I can just say that they downloaded all of the data from the Purple Airs, because a lot of them weren't actually online for participant preferences, I believe. And then I think right now they're looking at the PM 2.5 with the ATM calibration, but I know they're doing co-location and calibration, I think now. So they'll be looking more into that in the future. Just pulled it off.
Yeah, and this is all hot off the press. We were just in the field finishing up recruitment a few weeks ago, so yeah.
I think you partially answered the question of like that it was important not to leave the filters on the swamp coolers because this isn't a permanent solution, but you referred to being able to put them on if there was a wildfire event. Like, did the participants have filters to put back on? How did you, this is a minor question.
We did not, well, hopefully wildfire season for this year is over. We did have a number of extras that we left with our community partner because there was some interest from the community members, the participants, to be able to put them back up. And so we have given them the green light. Yes, please do go ahead and distribute these to those who want them. But we do want to make sure, we want to do more testing and analyze our results to make sure it is an effective method, before we go and tell them to use it. So that was it for the swamp coolers, yeah.
Is there an increased energy demand when the swamp coolers are running with the filters?
I don't know if there's a way to, you mean in terms of like electricity usage?
Yeah, right.
I don't know if we collected that data. It'd be kind of hard to pinpoint and, blame an increase in electricity bills on the swamp cooler filters, but that is something that we can certainly look into. Maybe
I
even
just didn't know if when the setup was tested, was there any testing about like the energy demand for running a swamp cooler with the externally applied filters?
You mean during Fresca Original?
I mean, even before that, like when the person who came up with this idea.
Right. I'm not sure. I'll have to get back to you on that point. I don't think Gina Solomon is online or Isabella Kaiser, but just in case they are, please feel free to chime in. But that is a good question. I'll follow up on that.
Other clarifying questions? Yeah, Jenny.
I just wanted to respond.
Oh, great.
Yeah.
I was part of the team that collected responses for the biomonitoring survey. And that was one of the questions, whether the participants were satisfied with their swamp cooler and the intervention with the filter. And I recall there not being a lot of responses that mentioned the electricity use or higher costs associated with the filter.
We did have hobos attached to it. So I know that they collect information on use. I don't know if they also collect information on electricity use. But yeah, we will look into that.
Hi, Jenny Quintana. Thank you for the presentation. I can't actually read this tiny print here. But
Do you want me to go back?
a question about the biosphere update.
Mhm.
First question I have is, I didn't catch the time of year that you're collecting the urine samples. So it's continuing through November, but was this a whole year of collection, or was it
Yes.
half a year? Or
It
what was-
started, and I think around March or April of this year. The study was delayed. It was supposed to have started last year. And so, yeah, we've been collecting samples kind of continuously, or as people are being recruited since April or March of this year. And it should be completed by the next couple of weeks.
And the reason I'm asking is it seems like a lot of those things you're measuring are going to be a lot higher in the winter months. And so, and the reason I'm bringing this up is that I also do community air work. And I don't want to do harm to a community by measuring something that's much lower than gives a whole picture of the year and saying that's because that'll be published and that'll be referred to as what the exposures are. So I just kind of want to make sure that's put in context of how different it might have been if it was in winter or something. I'm currently trying to get additional funding for an air study because we measured in a really wet winter in San Diego, which was way lower than usual. And I don't want to have that be the last word on that subject. So I'm being thinking about this, this issue.
Relevant, I guess, for both of our studies this year, since there was so much rain in California. I mean, the San Joaquin Valley is unfortunately always has, higher levels of these contaminants than I think we see in other parts of California. Regardless, for biosphere, we were hoping to be collecting last winter, but we did have some delays in the study. So we're not going to be able to capture the summer months, but I do still think we'd be able to see some differences, maybe even from March and November of this year, hopefully.
So the comparisons are longitudinal within the subject pretty much, because you do want variability to see.
Exactly, and that's why we also are doing some sampling where 8 of the families we're doing consecutive. So we're not only collecting urine samples for additional urine samples, but we're also collecting an additional time period of air sampling from those participants. So we'll be able to see some variability there too.
And can you go over the sample size reduction from the original plan? I didn't write it down, sorry.
So it was 90 and with 90 parent-child pairs, and now we're at 64 parent-child pairs. But we are collecting some additional samples from those families to try and make up a little bit of that gap, since we won't have as many urine samples as we were originally hoping to.
Yeah, that's unfortunate, but it happens in field work. Yeah. So I think it's really interesting that you're doing the parent urine and the child urine, right? So that's so interesting to see how kids might have higher levels relative to the adults. So that's still very valuable. Thank you.
I'll be really interested to see those results.
Hi, Jose Suarez. Question about going back to Fresca, actually.
Okay.
Could you remind me how long the intervention was for? And then I know that there was some biospecimen collection before and then during the intervention. Could you?
So what our hope was, we did install the filters. We tried to pretty soon after we collected their first urine sample. So they were installed, I think, in August. I want to say, I think late August. So they had the filters on their homes, for maybe a couple of months before, or a month or so before we went and collected their urine. But our hope was to see a difference between their work exposures and exposures from being in filtered air. And especially because we designed the study to take place during a wildfire event, we thought we'd be able to see some pretty extreme differences between being in wildfire smoke perhaps, and then being at home in filtered air.
Okay, so if I understood correctly, in August is the installation of the intervention.
Correct.
And then the first biospecimen collection was 2 months after, right?
It was before.
Oh, there was a before.
Yes, yeah, before the filter installation. We collected the first morning void samples, just one, to try and help establish baseline exposures.
Got it. And then after that, it was 2 weeks or 2 months after the filtration.
I think it ended up being about 6 weeks. Yeah.
6 weeks.
More or less. There was. We had installed the filters and then the hurricane came. And so we actually had to go and remove the filters and then put them back on. So there's a bit of a gap in between that period, but.
Okay, and then ultimately they were removed when?
They were removed just a few weeks ago. When we went and collected all of their urine samples, we also removed all the filters from their homes. So mid-October.
Okay, mid-October. So okay, August to October. And then you collected biospecimens at one point in time during the intervention, or
correct, just one point in time. So we would essentially go to their homes, drop off the urine collection kit. Their first collection would be that evening after they had gotten home from work. And then we instructed them to collect their urine the next morning. And we came and picked it up the next day and administered the biomonitoring survey.
Okay. Okay. Yeah, I'm just trying to get a sense of all the different
I know
components
it's a lot.
with that. And then saliva. And finally, for the indoor measurements, those were constant, or were there at certain points in time as well?
They were also at certain points of time. So what we wanted to do was hopefully capture exposures inside their homes, mostly not related to, cooking perhaps, because we're looking at pHs, VOCs, and metals. And we wanted to see if outdoor exposures from the wildfire smoke was getting into participants' homes. So we collected, I think it was 24 hours of the heavy metals, and then 6 to 8 hours for both the PAHs and the VOCs.
Okay.
And this is what part of what we did when we were pilot testing over the summer was to see, because we had some fears that our tubes would become oversaturated, especially for the VOCs. But from this pilot testing, we were able to see that 6 hours seemed to be okay for the VOCs at least.
And so what are your next steps right now? Have you gotten to data analysis yet?
Not yet. We still have to wait for the laboratory results to come back. So we're hoping to be able to start working on the data early next year.
Okay. Yeah, I'm very curious to see how that pans out.
Yes.
Yeah, it's unfortunate that there were no peak events to really
know.
find differences within the homes.
I
But
know. I mean, good for the San Joaquin Valley, but yeah, unfortunate for study purposes. Yeah.
Any other clarifying questions? We have discussion time. Yes.
Thanks for a great presentation, Laura Cushing. Could you just say a little bit more about the pilot studies for oil and gas that you're
That's just one of the
thinking
options
about?
that we're looking into. And I'll be presenting at the end of this afternoon as well about our hopes for next year, maybe having some of the experts in the field come and present about challenges and opportunities with biomonitoring for oil and gas exposures. So yeah, that is something that we are considering.
Okay, I want to check in about public comment. Rebecca, do we have anyone who wants to weigh in?
We didn't receive any public comments online yet.
No.
Okay, then we can proceed into the panel discussion. We have until just before 2, like 5 minutes before 2, to discuss as a panel what's been presented. So I can open it up much more broadly beyond clarifying questions. Jen, go ahead.
I guess this is a clarifying question, really, actually, is, you said you provided an indoor air filtration unit in the biosphere, or was that at the end of the study or at
Sorry.
the beginning? You had a little indoor air filtration unit, it looked like in the picture.
Fresca.
For
We
Fresca,
provided
sorry.
it around the same time that we installed the swamp cooler filters. And the reason that we did that, for scientific purposes, we would have preferred to, have maybe half the homes with a swamp cooler filter and half the homes with no filter. But our community partner was really adamant about having some sort of protection for all of our participants. And so that's why we ended up giving these indoor air purifiers to all of the participants in Fresca, and then the swamp cooler filters for half of them.
I see, so all of them had indoor air filtration. And this was just particles only, or did it have like charcoal for vapors and stuff?
I think they did have I know that at least the, one of the brands definitely had the charcoal filters in it. So I think they should have removed some of the VOCs as well.
So I'm kind of wondering, how do you know if it's except for that they all had filtration and only half of them had the swamp cooler, I guess.
I think we would hope to see a difference in between those who just had the indoor air filtration and then those who had both indoor air filtration and the swamp cooler filters. And the swamp cooler filters definitely were filtering out a lot of the larger particles. As I mentioned, both visibly you could see on the filters, and then also participants did mention that they noticed less dust in their homes. And that was participants who had the swamp cooler filters versus those who, we still have to analyze the data, but we're hoping to see a difference.
But you don't have PM10 measurements in the home, you just had the PM2.5 or?
I think we also did PM10, yeah. Purple air.
Well, it responds to PM10, but you can't tell what it is, right? I mean, they have a size thing, but it's not.
Yeah.
Awesome.
Well, and that's also part of our hope with Jeff Wagner's analysis, that he can do some of, figure out potential sources of the particles that we're seeing on the filters.
Okay, great, thank you.
And just to follow up on that, it will become a little bit of a challenge, right?
Yes.
If you don't see a difference between the groups, how much is that because there were not big enough events in the environment versus the introduction of a second intervention within that? What if the purple air is good enough for everything and you don't really need that additional filter outside, right? And if it is good enough, then you will not see a difference, not even if they're very high exposures outdoors. Of course, in this particular scenario, I would suspect that you're hoping that there is some sort of a difference, but it sounds like there would be two competing challenges against you being able to detect anything.
Yes, definitely. It will be a challenge and we hope to work through it as much as we can. Yeah.
I mean, that's the difficult part with designing interventions that, of course, would benefit people. And I see that the push from the community partners saying, well, everybody should have some sort of benefit in this.
Yeah.
But from the strictly scientific point, without you having that additional arm that did not have that extra intervention there, it might be a little challenging to discern.
But also if we're seeing a difference, in the indoor air in general versus outdoor air, and we know that even the indoor air purifiers are working, that's also good news to share with the participants, even if we can't see a difference between the indoor air cleaners and the filters outdoors.
Right, but which then becomes the question, right? So if you don't find a difference, you say, well, it's good enough. Yeah. Then does that mean that you don't recommend the swamp cooler filter or not, right? Yeah. And it's probably much cheaper, the swamp cooler filter, than it is the purple air, right? How much of a cost difference is
well,
it?
And they're just different too, because you can just have the air filter inside your home at all times, whereas the swamp cooler filters that they were looking at were specifically for wildfire events, for temporary solutions for these extreme events. So they kind of serve different purposes as well.
Well, hopefully you'll see something. Yeah. If not, you'll have to be very creative about what the message is that's going to come out.
Oh, yes, yeah.
Yes. Well, sort of following up on that, and also maybe somewhat pie in the sky, but what I'm sort of thinking about as I was listening to this is, you have these community partners who clearly were very enthusiastic about this study. And I wonder if there's some way to kind of maintain that enthusiasm and maybe have some sort of a rapid response, wildfire, study that could be done to, to be able to get those data that you had hoped to get. Especially because it seems like, I mean, people really were enthusiastic about participating and about the intervention. You know, they actually could see benefits inside their homes. So anyway, it's a thought.
Definitely. Thank you.
Did the monitoring equipment stay? Does Purple Air monitors stay?
We removed them, but I think we ended up, because we had to take all the data off, but I believe we ended up returning them to the participants' homes afterwards, or it is our plan to return them to the participants' homes so that we can continue monitoring. Yeah.
Hi, this is kind of vague advice because I can't remember the details, but I was listening to a presentation on UC Riverside Salt and Sea study. So I work some in the Imperial Valley, which is to the east of San Diego in a valley very similar to the Central Valley. And they had tested a bunch of low-cost sensors and found ones that really were much more responsive to PM10 specifically, because they had the same questions about the coarse particles as being significant for health, in addition to the fine particles that we think of as being regulated. So I'll look for that if you're interested and try to find it, because I think that might be the key for your air filters, just to really make sure you're measuring those coarser particles that would be filtered out.
Okay. Do you know if that's been published yet?
I was at a presentation. I'll try to look for the person in the slideshow for you. Sorry about that. My brain.
If you go down one slide. Oh, not that one. The picture of the, I guess it's
Pictures?
the one with the air filter in the room. Yeah, the indoor air. There. Okay. Yeah, that's a Lavoie. I recognize that because we have one, but so do other people. But those do the standard model, if that's a 300, which it looks like, does have activated carbon.
Yeah.
So you're
And
right,
the I'm forgetting the name of the other brand is actually the kind that I have in my house too. And so I'm sure that we had the activated carbon. Winix, yes. Winix was the other brand that we deployed as well.
And another question again, or comment, but I can't remember it now because I got backtracked. In terms of the Purple Airs, I didn't think they do PM10. I thought they just do the fine particles. They do the coarse.
I believe they do PM10 as well.
Okay.
Yeah.
They report it, but I don't know how long. But that's not what they're for. I mean, they're not. You don't use them for that.
Yeah.
That was the other kind of.
Okay.
Oh, yeah, and the other point is given it's something that Jenny brought up about, so this year probably the worst air quality in these areas in the Central Valley won't be during the summer. Right? It's going to be during the winter when everybody's burning wood smoke. And I don't know if there's an opportunity to, I mean, that's a lesser event.
Right.
But I mean, given, I think the fire season is over, which is good news, but because right now there's 7 inches of new snow up in the Sierra. So that's always a good sign that fire season is over. So that's today. We got 7 inches of snow down the path. So that means fire season probably truly is over, because when you get the first snow, it's pretty much ended.
And people also around this time stop using their swamp coolers as well, because they turn them on when it's hot during the summer months.
So they won't be used that true.
Right, so they won't be using those anyways during the winter.
Right.
I know that another source of PM and PAH pollution in those areas is often from agricultural burning. I don't know how that intersected with what you were looking at.
Well, I mean, we did collect outdoor air monitoring data regardless. And I think when they were in the field in Bakersfield, there was still pretty poor air quality, just based on EPA air now. So again, we won't be able to see likely components of wildfire smoke, but there was certainly poor air quality in the San Joaquin Valley this summer, just for different reasons.
Yeah, I just think, I know this was designed around potentially an intervention for wildfire smoke events, but I can imagine a lot of useful information and health relevant information still coming out of this. I know it's a downer when you're doing field work and the thing you were trying to test doesn't happen.
Environmental sampling is very difficult.
Yeah, environmental sampling is difficult, but it seems like there's promise there anyway.
Yeah, I hope so.
Look forward to hearing about it. Jose.
So following up on it, do you have any plans about maybe bringing it back to life in a part 2 and hope to capture one of these wildfire events?
It's not currently in the plans, but it is certainly something that we can consider for a future study. I know we've gotten a lot of questions about that and the study PIs as well. So I think it depends on, interest in all parties involved and funding and all that.
Yeah, funding is a big thing, and maybe we can talk about this offline or whatnot about how much it costs to do something like this with 51 participants, and the feasibility of if you don't see anything,
Right.
I guess you might be inclined to repeating this and hopefully catching a wildfire event.
Mm-hmm.
Along those lines, just to tag on with that of like, you all probably could say even more than we could about how much work it takes to establish the community partners, the relationships with the study participants and all of that. And in a way, you've done all that. And so the idea of repeating that seems like a good use of resources. If an event arises or there's some way that you could construct it around that, then it's not like a different study starting from scratch in a different population with different community partners. You've done all that huge amount of work that it takes to do that kind of community-based study.
Right, and you wouldn't have to, re-enroll participants because they've already been enrolled.
Right.
I mean, you have to get a new IRB, I suppose, to do the extension, but that's the easier part, right?
And that is maybe a larger program discussion too, is, we've seen that in all of our studies that we've had recently is, we have these opportunities to maybe go back and study for additional exposures, but then are we missing out on potential exposures in other communities that we haven't yet reached? So these are program discussions that we're having, and not really easy with the limited resources and time, of course. Yeah. We'd like to do it all and go everywhere.
Yeah, I hear that. I think I just kind of wanted to support that of like just an acknowledgement of how much you have already invested in some of these partnerships, in learning about the community and the setting and the intervention. And it's such an investment of staff resources and community resources and all of that. And not even like if nothing came of this, but also just keep thinking about ways to capitalize on that incredible investment and what you all have learned and who you've recruited and how you've educated the community and what the community partners now know and all of that. That just to, like, I understand we can't get everything we wish for because you'd also like to go design other studies, but just supporting from the quality of what you've put together, being able to continue to use that.
Thank you.
I would support that. Yeah, Martha.
This is Martha Sandy. I wanted to say thank you. We hear you with your thoughts on this. I just wanted to also say this is a biomonitoring component put onto an existing study. So it's a larger conversation even than just within the program, but we will take that back. Thank you.
Yes, lots of interest in expanding the study.
Other thoughts, discussion points, comments? Time for like one more. Anything, Rebecca, that we should note from online?
We had Isabella pointed out that
Oh, Isabella's great.
purple airs only collect info on PM 2.5.
Oh, okay. Thank you. Isabella clarified that purple air monitors, at least we're only using them to collect PM 2.5 data.
Okay, so with that, thank you very much, Stephanie, for the presentation and really an acknowledgement of all the staff work that goes into all of those projects. And it's really cool to see them coming through. We look forward to hearing results. We will break for a 10-minute break now. And my computer just turned off. So let me just check and see if there's anything else I need to tell you about that before we break. Hang on one sec. We will reconvene at 2:05.